The Chinese CDC revealed that the number of new cases of COVID-19 had peaked with nearly 7 million cases per day. The number of COVID-19 cases and visits to fever clinics across China peaked on December 22 to 23, 2022, with nearly 7 million new cases and about 2.87 million fever visits, according to the report. New data published by the Chinese Center for Disease Control and Prevention, CDC. Since easing COVID-19 response measures on December 8, 2022, China has stopped mandatory mass testing, causing the total number of tests to gradually decrease from 150 million tests/day on 9/12 to 7.54 million on January 1, and to a low of 280,000 on January 23, according to the report. Based on the number of positive cases reported through mass testing, the number of new COVID-19 cases peaked on December 22 at 6.94 million, and fell to a low of 15,000 on December 22, 23/1. At the same time, the total number of visits to fever clinics nationwide reached a peak of 2.87 million on December 23, 2022, and dropped to 63,000 on January 23. Visits to fever clinics in rural areas peaked on December 23 with 922,000 visits, but fell 94.6% to 50,000 on January 23. Some provinces in China have established rapid test results collection mechanism to report positive cases since December 2022. On December 19, the number of reported cases reached a peak of 1.89 million, then dropped to a low on January 23 with 105,000 cases. National Health Commission officials said on January 19 that China had passed the three peaks of the COVID-19 wave this time around, when the number of fever clinic visits nationwide peaked on January 23. 12. The number of emergency cases nationwide peaked on January 2, and the number of critically ill patients in hospitals peaked on January 5. Specifically, the number of COVID-19 patients in hospitals peaked at 1.63 million on January 5, but this number has been decreasing since then. From December 27 to January 3, the number of severe cases in hospitals increased by about 10,000 cases per day to a peak of 128,000 cases on January 5. The number of hospital deaths peaked at 4,273 on January 4. This number continued to decrease, until January 23, there were only 896 cases, 79% lower than the peak. In terms of surveillance and tracking of SARS-CoV-2 virus mutations, the CDC report said that from monitoring in hospitals, severe cases, deaths, and tracking people who were imported China landscape via land, waterway and air, the results show that BA.5.2 and BF.7 are still dominant variants in the country. No new mutant strains have been recorded.